Managing chronic pain can be challenging. When standard medications like gabapentin or acetaminophen don't provide enough relief, a stronger option like oxycodone may be necessary. But for Medicare patients, prescribing a controlled substance like oxycodone requires an extra step, prior authorization, or PA. In this video, we'll go through each part of the PA process for oxycodone 5,325 mg combined with acetaminophen. First, let's understand why Medicare requires prior authorization for controlled substances. Controlled medications come with higher regulations due to their potential for misuse. Medicare's PA process ensures that medications like oxycodone are only prescribed when truly needed. This process protects patients by promoting responsible prescribing and careful monitoring. Now, let's dive into the step-by-step process of securing Medicare's approval. Starting the prior authorization process on CoverMyMeds. CoverMyMeds is a widely used platform that simplifies PA submissions for providers. Here, we select the form specific to oxycodone and fill in all the required details, from patient demographics to pain management history. Gathering this information up front helps reduce delays by providing Medicare with everything they need from the start. Entering patient and provider information. For the patient, Medicare requires full name, date of birth, Medicare ID, contact info, and address to verify eligibility. Next, we enter the provider's information, including the National Provider Identifier, office address, and contact details. Having this information ready ensures that Medicare can reach out easily if they need additional details or clarifications. Specifying the drug details. Here, we list oxycodone 5,325 mg with acetaminophen and provide the exact dosage, 1 tablet every 4 to 6 hours as needed. This dosage gives the patient flexible pain relief without overprescribing, showing Medicare that the prescription is tailored. Answering Medicare's clinical questions. These questions help Medicare confirm that the patient's pain history justifies the need for a controlled substance. We start by entering the primary diagnosis code, which is ICD-10 code 𝗔𝘂𝘁𝗵 for chronic pain syndrome. This diagnosis code supports the request by highlighting the patient's ongoing struggle with chronic pain. We also provide a detailed history of previous pain management treatments. Medicare expects documentation that shows the patient tried non-opioid options, like gabapentin or acetaminophen alone, without finding relief. This information builds the case for using a stronger option like oxycodone. And here's where Staffingly can make a difference. Handling all these details and meeting Medicare's documentation requirements takes time and attention to detail. Staffingly's team is trained to manage these steps carefully, ensuring accuracy at each stage of the process. By outsourcing these tasks, healthcare providers can focus on what matters most: patient care. Justifying the need for oxycodone. Medicare needs a clear, documented reason for using a controlled substance. Here we explain why alternative medications like gabapentin were not effective. This justifies switching to a stronger opioid medication like oxycodone, while showing that it will be monitored responsibly. Uploading supporting documentation. Medicare requires complete records of the patient's pain management history, including treatment notes and summaries. Each document supports the case that this patient genuinely needs oxycodone. Once all documents are uploaded and reviewed, we submit the form for Medicare's approval. Medicare then evaluates the request, confident that every detail has been covered. Let's also touch briefly on ICD and CPT codes. For any Medicare PA process, accurate codes are essential. Using ICD-10 code 𝗔𝘂𝘁𝗵 helps Medicare understand the medical need for oxycodone by confirming a chronic pain diagnosis. These codes play a key role in the approval process, especially for controlled substances. So what's the takeaway? The PA process for oxycodone under Medicare is complex, but it's there to ensure patient safety and responsible use of medications. By outsourcing this process, providers can rely on Staffingly for accurate and thorough PA management. At Staffingly, we handle prior authorizations, virtual assistance, and data entry, freeing up time for healthcare teams to focus on patients. Interested in learning more? Contact us at support@staffingly.com or call 800-489-5877. Finally, for those watching, we'd love to hear your experiences with the PA process. Have you tried outsourcing? Let us know in the comments. Together, we can help make prior authorizations easier for healthcare providers and improve access to necessary medications for patients.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.